The Maine Drug Policy Coalition and several lawmakers were at the State House today to advocate for a bill that would decriminalize the possession of small amounts of drugs for personal use. Representative Lydia Crafts of Newcastle is the bill sponsor. She says the current system has not worked. Last year, more than 600 people died from substance use disorder. While there are approximately 170,000 people in Maine seeking treatment, Crafts says there is only one center that's open 24 hours a day. In addition to creating more receiving centers, Crafts says the funds will increase access to treatment, including mental health care, peer support, and harm reduction. The director of Maine Drug Enforcement Agency says in the concern about the number of overdoses in the state, he says he's seen the effects firsthand. Still, he says he does not support the decriminalization of the possession of drugs.
We cannot arrest our way out of this disease. And so what we need to do is shift the focus away from punishment through our criminal system into a public health narrative. So we are saying the way to do that best is to reduce barriers and to increase and invest in the services that we know people need and benefit from in order to live safe, healthy, productive lives.
By decriminalizing possession across the board, that would take away those, in some cases, those barriers, those boundaries, those guardrails that some people need in order for them to stay on track. And again, we're just concerned that that track, if we decriminalize across the board, would remove those boundaries, those barriers, those guardrails, and also send the wrong messages to the folks who pay attention to law.
Kraft says the bill maintains existing legal consequences for those sharing, manufacturing, selling, and trafficking drugs.